In medicine, timing it can be absolutely everything. For someone with Crohn's disease, a new complication can be anything from a major headache to a full-blown life-threatening crisis. So, how in the world do doctors tell the difference? How do they know when to rush to the OR and when they can, wait? That's what we're going to figure out. Okay, so let's meet our patient. We've got a 50-year-old man. He's just gotten his Crohn's diagnosis, and now he's staring down the possibility of surgery. This isn't some textbook problem, right? This is a real person in a real situation where making the right call at exactly the right time is what matters most. So what is the deal with Crohn's disease anyway? Well, it's this chronic inflammation. But the word you really got to latch onto here is transmural. That means the inflammation doesn't just skim the surface. No, it goes through the entire thickness of the intestinal wall. Think of it like a crack that goes all the way through a dam. And that right there is what sets the stage for all the really serious problems we're about to get into.
All right, so this patient's got a few things going on, several possible complications. Our job, our mission, is to sift through all of them and pinpoint the one true surgical emergency.
And that brings us to the big medical question. A laparotomy, that's major abdominal surgery. We're talking a big incision, a full exploration. So which one of these potential problems means you have to do that immediately? Okay, here are our 5 suspects. We've got an intestinal obstruction, 3 different kinds of fistulas, which are these weird tunnels between organs, and then something called a free perforation. They all sound pretty bad, right? And yeah, they are. But only one of them is the drop everything, code red, get to the ER now kind of emergency.
So how do we sort this out? Well, doctors use this really critical framework. They put every potential surgery into one of 2 buckets, elective or emergency. And honestly, understanding this one distinction is the key to the whole thing.
And here it is, laid out side by side. It's really all about 2 completely different paths. On one side, you've got elective surgery. Yeah, surgery's needed, but you can plan it. You have time to get the patient stable, maybe try some medications first. On the other side, you've got an emergency. The clock is ticking. The goal is just survival right now, and surgery is the only option on the table. Okay, with that framework in mind, let's start crossing some of these suspects off our list. We're going to look at the conditions that are serious, for sure, but they aren't that life or death right this second kind of serious. These are the elective cases. First up is intestinal obstruction. The best way to think about this is like a complete standstill, a massive traffic jam, but inside your gut. After years of inflammation, you get all this scarring and narrowing. That's called fibrosis, and it can literally block food from passing through. It's painful, it's serious, no doubt about it. But is it a rush to the OR emergency? Typically, no. The verdict here is elective. Doctors will usually try to manage this first with things like resting the bowel, maybe some medications. Surgery is definitely an option, but it's a planned one, and only if the medical approach isn't working. All right, next up, that group of fistulas. Like we said, these are basically tunnels that have formed where they shouldn't be, connecting the intestine to other parts of the body. And it all goes back to that deep, transmural inflammation we talked about earlier. It just punches right through. So our list has one going to the bladder, one connecting 2 different parts of the intestine, and another to the vagina. Now, these can cause some really unpleasant, life-altering symptoms, but the first line of attack is almost always medical therapy. We're talking powerful drugs that can sometimes heal these tunnels up without ever needing a scalpel. So the verdict for all 3 is the same. Elective surgery is only on the table if the meds fail. So we've now ruled out 4 of our 5 suspects. While they are definitely serious, they aren't the ticking time bomb we're searching for. That leaves us with just 1. And this is a whole different ballgame. And the answer is free perforation. This isn't a blockage, it's not a weird tunnel. This is a complete breach. A hole has literally ripped open in the wall of the intestine. This kicks off an absolutely catastrophic chain reaction. It's like a raw sewage pipe bursting inside your house. First, the hole forms. Then, all the toxic stuff from inside your intestines spills out into the sterile abdominal cavity. This triggers a massive body-wide infection called peritonitis. And just like that, you have an absolute life-threatening emergency on your hands. And the medical literature is crystal clear on this. This isn't a wait and see. It's not a let's try meds. The source material says it perfectly. Immediate surgical intervention is mandatory. It is not an option.
It is the only thing that will stop the infection and save the patient's life. So let's bring it all together now. We started with 5 very serious possibilities, and by using that simple but powerful framework of elective versus emergency, we found our final diagnosis. The final diagnosis just pops right out when you see it all laid out like this. The obstruction, all those fistulas, they're elective. You plan for later. But that free perforation, that's an absolute emergency. The surgical timeline couldn't be simpler. Operate now. And that one distinction is the difference between a planned procedure and a desperate race to save a life.
You know, this case just highlights the incredible pressure of medical decision-making. I mean, sure, a free perforation is pretty clear-cut, but a lot of complications in chronic diseases like Crohn's live in this gray area. And it leaves you with this really big question. As our treatments get better and better, how will doctors continue to balance the risk of going in too aggressively against the risk of waiting for the next disaster?